for coronary artery disease?
For coronary artery disease, we first have to assess for the severity of the coronary artery disease. Suppose coronary artery disease, we called it as a significant or critical when one of the major coronary artery, there are three basic coronary arteries like left anterior descending, left circumflex and right coronary artery. These three are main epicardial coronary artery. If major coronary artery is showing blockage of more than 70%, then we call it as significant blockage. But if the blockage is of less than 70% or it's physiologically not significant, then we treat the patient with some antiplatelets, these are the blood thinners, and statins. These are the cholesterol lowering medication. Also they reduce some inflammation in the blood vessels. So for non-significant coronary artery, we treat them like this. But if the patient is having significant coronary artery disease, suppose the blockage is of more than 70% is the focal blockage, the patient is having symptoms regarding that, like patient is presented with angina or patient presented with the acute coronary syndrome, like heart attack, then the treatment depends upon when the patient is presenting to you. Suppose patient presenting you in the acute coronary scenario, we have to take the patient into cath lab and we have to open that coronary artery as soon as possible because that coronary artery is 100% occluded because of the thrombus. But if the patient is presented with the unstable angina or unstable scenario, we can electively plan that surgery within 24 hours to open that coronary artery. So basically in the significant coronary artery, angioplasties are the mainstay of the treatment. But if the blockages are more, like patients having three vessel diseases or the blockages are such that we cannot take the patient for the angioplasty, suppose patient blockage of in the bifurcation, we cannot negotiate it, or the disease is more associated with the diabetes, then the mainstay treatment can be the coronary artery bypass surgery. Also, there is recent advance in the coronary artery bypass surgery that we can undergo it with the minimal invasive coronary artery surgery. That is when initially they used to open the sternum to expose the heart and do the bypass. Now they are doing it with the 3 to 4 centimeter incision. So they are patients are undergoing coronary artery bypass surgery. So if the patient is having not having any symptoms, patient is having suppose stable coronary artery disease, then we can manage the patient on antiplatelets, then statin. There are certain vasodilators are also there, like nicorandil are there, nitrates are there. So these are the beta blockers are there. They are anti-anginal medications. So we can treat the patients on the medications and keep the patient on the follow-up.